We're at a historic turning point in the HIV/AIDS epidemic in America. Every hour, 2 young people become infected. And that's why we're here today, to mobilize all sectors of society to make the investments that are needed in research and to involve all sectors of our communities, whether they're health professionals, scientists, civil society, to address the issue of youth and AIDS.
I'd say in recent years we've done a better job at testing people, all people, including youth. But the weak link is sort of ensuring that they get into care. Certainly as we implement the Affordable Care Act, we'll have more people covered by insurance, and that will help. But we also need to make sure that youth aren't falling out of the system, that we have youth-focused programs, whether it's in schools and in healthcare settings and other things, that all try to work together to make sure that kids don't fall through the cracks. One of the things we know that especially, I mentioned that Black and Latino, gay men, gay youth are among the highest, most disproportionately impacted groups. We also know that they're among the least likely to know their HIV status. So helping out figuring out better ways to ensure that they know their serostatus, because we know that most transmissions occur by people that don't know their status. So if we can do a better job helping people learn their status, we can probably make a difference in reducing transmission.
I think young people in this country need to know about HIV is that it can happen to them. It's still a very serious disease. People still die from it. Yes, it is manageable, but it is still a very hard disease to live with. My message to young women would be really to empower them, to tell them that they really need to love themselves enough to protect themselves.
I think the best programs are when peers educate one another. So when someone who is MSM educates someone else, that's the best thing, because they can see someone that looks like them, that's going through the same things that they're going through, and they can relate. It's something different to hear a message from someone who looks like me than to hear like someone older or someone of a different gender, or even like I like to see people that look like me as far as racially. I'm more likely to listen to a person of color rather than a white person, simply because I feel like I can relate to them more. So just using that peer-to-peer education and making it culturally competent as well.